Hello folks, welcome to Good News Covington County with Brother John, and today my distinguished guest, Dr. Mark Griffin, who's head of the emergency department, I guess is what y'all call it, here at Andalusia Health. We're going to talk to him about what they're doing there and the new things that they're bringing into the community to serve you, make you aware that Andalusia Hospital has moved an awful lot forward in a very, very short time, all with the aim of giving you better care, more care locally. And believe it or not, that'll save you a lot of money in the meantime. But who's worried about money when you're in the emergency room, right? Dr. Griffin is part of South Alabama. He is from Troy, Alabama. He went to school at South Alabama, University of South Alabama, where he took every course he could take in biology at that time. Ended up with 4 majors, but when he graduated and did his graduate work, he was a doctor, and he still is. He's also a sports fisherman and of some renown, and check him out on YouTube. I think it's at the worst good for some laughs, but you'll find out what a down-to-earth person that Dr. Griffin is. He's a great, great guy. Glad to have him in the community. I can vouch personally for him. He's treated me twice in the emergency room. Look at me, I'm here today. Must be good. So anyway,
lucky is better than good. You never know.
Well, I've always said I'd rather be lucky than good.
That's right.
But you know, if I'd been lucky, I wouldn't have been in the emergency room.
True that, yeah.
And, you know,
yeah.
Maybe I was lucky I got to the emergency room.
Well, there's also that thought.
That's right. So Dr. Griffin, tell us about the emergency department here at Andalusia Health.
Sure. Well, I'll tell you what happened, how I wound up here 7 years ago, almost 8 years ago. I came over just to work a shift. I think it was a Thanksgiving Day, just to give relief to the guy that was here. You know, somebody needed a break or something. So I came over and worked one shift and didn't think much about it. I'd done that before. But there was something very intriguing about this emergency department. I've been in several. I've been in, you know, really good ones and some not so good ones and really big ones and small ones and medium-sized ones. But it was the people here, the dedication of the nurses that really attracted me here.
Right.
So I came back in December and did another shift or two, and by January I signed on full time. So the initial attraction was the quality. It was that the people back there really, really cared about what they were doing. And most important to me, they really cared about the person on that stretcher. You know, there's an old saying in emergency medicine that when the patient lays down on the stretcher, their ears must fall off. Because we do and say anything in the department, we don't realize they're human beings laying over there, right? And that was old world stuff, and this was different. These people really cared. And then I came to find out that all of these nurses were actually seeking certifications that they didn't have to. The Certified Emergency Nurse Registration, the CEN, the Advanced Cardiac Life Support, Pediatric Advanced Life Support. Every single nurse in our department is an instructor level at all of that. Wow. All of them are. They're all certified at inserting different types of lines, like in the neck if you had to have one put in, or doing arterial blood draws, actually intubating people in an emergent situation. Right. If you say we had some mass disaster and a lot of people had to be put on respirators for that, our nurses can handle that. Wow. So it was an amazing thing to come into, and then as I got here and sort of watched things occur and grew along with the program, we began not only growing, but finding ways to get better and better and better, to enhance patient care, to really make that experience be the best it can be. An ER experience is never a good one, but to make it as good as it can be.
You're in trouble is pretty good.
Well, that's true. But we wanted to get better. We wanted to be different. We wanted to be, in short, we wanted to be perfect, and you can't. But we try awful hard to be, and that's the thing you mentioned to me before we started. How do you let people know what you're doing if you don't experience it? You know, well, I don't want people to cut themselves with a chainsaw to come find out
that you're good.
What we're doing.
Yeah.
But we want to let people out there know that this ER and this hospital has reached a point where you will get better care here than you will get at a large majority of the hospitals around the country. And that sounds like we're bragging a little bit, and we probably are.
But y'all, you know, it's not bragging if you could back it up. And you've got this hospital in the last 2 years in particular. I mean, I'm not going to say that the John Yanes predecessor was not a great person. I mean, but John Yanes has helped people like you that knew what needed to be done to lead this hospital forward.
You're exactly right.
You know, into a place where you're contemporary with the hospitals. I'll say it in Montgomery or Dothan or Pensacola that we've traditionally gone to, and these aren't. Steer your fire for a second. These aren't second string scrub doctors we've got here. These are as fine a doctor as you'll find, cardiologist and any ENT specialist, emergency room specialist, as you'll find anywhere, and they've got the paperwork to prove it.
Yes.
You've got, how many certifications do y'all have besides all these for your nurses there in the emergency department? Do you have time to list them all?
That you don't, and there's not one that we don't have. There's one that we're particularly proud of, though.
Okay.
Any emergency room you go to anywhere in this country, I don't care if they're seeing 1 million people a year or 55 people a year, 25% of those patients that come to that door are going to be pediatric patients. So, and that's the thing, that if you're not trained as a pediatrician, that you generally don't understand what it takes to treat pediatric patients. We're talking about from birth to 15 or 16 years old, right?
Right.
And if you're going to see 1 out of every 4, you better be good at it. You better know what you're doing.
Yeah.
And there's a program across the country, it's federally recognized, that's called Pediatric Readiness Program for emergency departments. And we were surveyed this past year and scored 96 out of 100. That's an unheard of score. Nobody in this country has scored that. Not the Mayo Clinic, not anybody. I mean, 80-something's the best ever done. We did 96. And so you're talking about certifications. We're particularly proud of that. So, you know, we don't mind glowing about that a little bit, you know.
If you're an Alabama boy, you used to be a #1.
Well, that's right.
And that's good to see.
Now, you made a football analogy. You saw Friday Night Lights, right?
Yeah.
All right, well, that's what we are.
Yeah, I agree.
We're that little team that nobody thought much of, but I'll tell you what, we're at the top of the heap when it comes to doing what we do.
Well, you know, there's so many analogies about the little person that's good, you know, the little engine that's good.
Thomas.
Thomas, you know, all of that kind of stuff. You don't have to be the biggest dog in the fight to be the best dog in the fight.
Right. That's
all
right.
you have to do is be the top dog. And, you know, I don't think people in Andalusia, I know that's what you're trying to do is to get that message over, and I try to do it. I'm a strong advocate for Andalusia Health in the hospital, and I'm not on the payroll. I didn't play a doctor last night, and I didn't sleep in a Holiday Inn, but they are really trying to communicate to the community, not just Andalusia, Top, Red Level, Kinston, Florella, all the communities, Pleasant Home, Carolina, Brooklyn, you know, Bogan Level, all these places around the county that you don't have to go away from here to get top quality medical care. I mean, believe me, as much as I've been out of the hospital the last year and a half, I know. And I'm, you know, obviously it didn't hurt me. These are good doctors. And this is a good one right here. And I'm sorry to interrupt you, but I just think that Andalusia has a jewel here.
You know, I like hearing your excitement about it, frankly. I do.
Well, they have a jewel here in Andalusia that's greatly unappreciated.
Yeah. You know, you mentioned Mr. John Yanes a while ago, and he has been a real supercharge to this hospital. He is a gem, and so pleased that he came here. And I'll tell you something that he did that we ought to touch on for the folks at home is that he approached me and Dr. Parker, who is my partner currently. Dr. Parker is boarded in both internal medicine and pediatrics and has vast experience in hospitalist medicine, and I'll touch on that in just a minute. But Mr. Yanes asked us, would we be interested in, we had talked, Parker and I had talked before about integrating emergency medicine and hospitalist medicine. Now everybody knows what emergency medicine is, right? I mean, you're cut or sick or hurt and you go to the emergency room. But what about hospitalist medicine? If people say, well, what is that? What does that mean? Well, what that is physicians that are specifically trained to take care of people in the hospital. Just like I'm specifically trained to take care of people in the emergency room.
Right.
An orthopedic doctor is trained to take care of bone things. These guys and gals are trained to take care of people in the hospital, meaning that your hospital stay will be shorter, most likely.
Right.
It'll certainly be more coordinated. It'll be much more cohesive to your specific injury or illness, because hospitalists don't have anything to do but stay in the hospital and take care of you. See, so what Mr. Yanes saw as a vision was, let's put the ER and the hospitalist together.
Right.
Because when you come in, most of the people that get admitted are going to come through the emergency room right first.
Correct.
You're sick or hurt, and you wind up upstairs. And so we wanted to create a model where that would be a perfect transition, so that you come to the ER and I decide, well, you really need to be admitted to the hospital. You don't lay down there for 2 or 3 hours waiting around to decide who's going to do what.
Right.
We just pick up the phone, call our partner, the hospitalist, and they go, fine, send them up, we'll take care of everything.
Right.
So it makes the transition for the patients a lot better. It's a lot smoother. It gets you off that ER stretcher and into a real hospital
Right.
bed with the people that are going to be taking care of your needs and defining your care. So the hospitalist it may be new to Andalusia, but it's not new to the country, and it's certainly taking the country by storm.
Right.
Dr. Parker is well trained in hospitalist medicine. He's excellent at administrating of it and at working at it. And so we've done that here.
I think you've got like five people that are participating.
We do.
Hospitalists.
Dr. Rainier Burke.
Right.
Dr. Erica St. Illis.
Right.
And Dr. Parker himself.
Right.
Along with 2 nurse practitioners that are working with us to take care of that. Robin Livingston and Mark Chapman.
Right.
And that whole team, is combined to take care of your hospital care while you're here.
Right.
And then when you're discharged home, of course, all the records and the follow-up goes back to your regular doc.
Correct.
And so you say, why would we do that? Why would you even want to do that? Well, you mentioned this to me earlier in our discussion. If I'm a doc in an office and you're there to see me at 9:30 and I'm still making rounds at the hospital, you're going to wait.
You're gonna wait.
If you're there and at 11 o'clock I get called to ICU, you're going to wait.
Right.
Now, both things have their pluses, right?
Sure they do.
To have your regular doc at home is a great thing. I mean, that's perfect. That's what you want. But sometimes there has to be a handshake.
Correct.
There has to be a help me kind of a thing here. And when we got a program in place that can help, it only makes it better. It makes it better for everybody.
Well, thank you so much. We're gonna have to close for a minute for some commercials. We'll be back shortly. Welcome back to another segment of Good News Covington County with Brother John. So glad to have Dr. Mark Griffin here with us today. He's been talking about the emergency department and Andalusia Health and the hospitalist program. And we're glad to have him as a great guest, very informative. Now, one of the things that we were talking about during the break was the technology that's available to the hospital. And the other thing is that although we want to encourage you to come to Andalusia, and these guys realize that sometimes you need to go somewhere, or that you might want to go somewhere else and get care. And we'd like to talk about how seamless that is for you and how it can work and how they make that work for you. And then also how they can use technology and are using technology every day here in this hospital to serve you, to bring the finest specialists in this part of the world online to you if you're in an emergency room or if you're in a hospital room here. And so we're going to talk about that in the next few minutes too. So I'll turn it back over to you, Dr. Griffin.
Well, thank you, Brother John. Well, I'll tell you, regarding things we do, can do, and can't do, there's Clint Eastwood probably said it best when he said a man's got to know his limitations.
That's right.
So we do know that, and not only do we know that, it's not that if in any given setting you can only do what your tools are. You can't put a carpenter in the middle of a field and say, build me a house with no tools, right?
No lumber.
So we have every technological capability in this hospital that there is in any hospital in this country in terms of our ER and our patient care.
Could you repeat that? Because there are people like me that are hard of hearing.
We have every capability from a technology perspective as well as training perspective in our ER. And I think that's important to know, that when you're there, You're not there looking at equipment from 1985 or 1991. You're looking at stuff from late 20s, 2015, 2016, 2014. All of our stuff is up to date. Not only is it up to date, but we know how to use it.
Right.
And if you come to the emergency department with something that we know in the end we are not going to take care of because we don't have the facility, meaning interventional cardiology, advanced surgery.
Right.
Those people are going to have to go somewhere else. So what is our job then? It's not to just throw you out the door and say go somewhere, right?
Yeah.
We've developed a network with all of the great specialists in this area, and we call them and say, hey, we've got XYZ over here, they've got this problem and we need you to take care of it, and they say to us, fine, send them on. So our job is to do all the upfront work. Make sure that you're stable, that you're doing as well as you can possibly do, to get done all the preliminary work, so when you get in their hands, it's all done, and they just need to do their specialist work, right, and then bring you back here. But when it comes to doing what we do regarding the technology that we have, it can't be beat anywhere. It just can't. I mean, if we needed say a neurologist to come on and talk to somebody that may or may not be having a stroke, just right, to do a neuro exam, or a psychiatrist to do an exam for evaluation or something, we can actually roll a big monitor in the room and do a two-way TV interview, yeah, where they can actually see and talk to the patient and do that exam. So we can always be in communication with things that we don't have, but we have everything we could ever possibly need to take care of what we need to do.
That gives you the advantage, and to me, the patient, the client, the advantage of almost 24/7, if not 24/7, having the ability, if we don't have that person here, to get in video conference with a specialist in Pensacola or another big hospital. And I do want to share something about, I have a son that's in a surgical tech program at LBW. He's been doing his, they're about to end up August 12th, and I hope that he can get a job here, but because he wants to continue going to college and then to med school. But he has worked in a number of these hospitals in this area as a part of that. And he doesn't tell me about who he works on or who he works with or anything like that. That's, he's not supposed to. But he tells me what they do. In other words, I did a shoulder replacement here with with a doctor, and he led us and did a knee replacement. And he will tell you, as he's told me, I just soon do those replacements here in Andalusia as any place. And this, in the last 4 months, he's probably done 250, 300 procedures. That says a lot for Andalusia. That's a consumer endorsement from one of the people that, and he doesn't have a dog in the fight. Right. He doesn't work here. He's not on the payroll, but he's worked with good osteo doctors and OBGYN doctors, all kind of cases. And I know he's a pup, but he's got good enough sense to realize good care. And I just wanted to say that because I believe it. Anyway, we were talking about those that technology and what it brings, which really allows you and the staff here, not just in the emergency department, but throughout the hospital, yes, to be connected with, I guess if you wanted to go to John Hopkins, you could get a consult from there.
We have.
And well, you have. So that's the kind of thing that's available. Why drive to Boston or Maryland for that kind of care when you can get it here? The internet's changed what y'all are doing.
Of course it has. One of the things that I say a lot, John, is that when we all choose to be where we are because this is the kind of lifestyle we want to live, right?
Right.
I mean, frankly, most of us could practice anywhere we want to.
Yeah.
Right? I mean, clearly, but I personally choose to live in small town South Alabama. I was born and raised in South Alabama. I did all my schooling down here. And the comment that I have made for many, many years is that we can be small town, but we don't have to be small-minded.
Correct.
It means we can live in this area and still be the very, very best at what we do. And that's a mantra that I have just stated over and over and over throughout the years, and it's a thing that I kind of insist on when I'm working somewhere, is that we all buy into that culture of excellence, of looking after people. That this is what we're trained to do, mm-hmm, is to have a heart, care about someone's injury, care about someone's illness, and do the very, very best we can to take care of it. There's no excuse for failure in that regard.
Right.
There's just not. And so yeah, I love the small town part, and I love being that guy that nobody thinks that. And when I say that guy, I mean the hospital, the department. This whole hospital here is sort of that dark horse, right? Nobody realizes how really good we are, and that's the fun part when they find out.
Did you ever see the movie about Man of War?
I did.
You're kind of like Man of War, you know. This was a small horse that came from nowhere to win the Triple Crown. Is considered is a standard by which many thoroughbreds are still judged. But I remember there's a scene when the jockey's on. They're at the gates. They're about to be released, and one jockey looks over at the jockey on Man of War, who, by the way, only had one eye. He couldn't see distance, like the other jockeys. Looks over at him and says, "That sure is a mighty small horse." And the jockey looks back at him and he says, "He's going to look a lot smaller when this gate opens."
That's right.
And sure enough, the horse took off. That's Andalusia hell.
That's right.
You're
a good analogy.
Man of War.
Well, I think it isn't me. There's a culture in this hospital that I'm really glad to come on the show and talk to you about it, because the most difficult thing that we have to do is not training our people. It's not getting really good at what we do. Those are not hard to do. It's not getting our employees, our caretakers, to buy into a vision of culture of excellence. That's easy to do. The hard thing is getting everybody in all the communities you named a while ago to understand what we really have right here, what a gem this place is. And I know we sound like we're just, tooting the Andalusia health horn, and we are, but I think it's important when it involves your health that you can trust what we're doing.
And when I had I'm just saying, there are some things that have to be done there somewhere else. But I can remember the stress that my wife was under when I was in another hospital away from here, that slept in the hospital every night, that kind of stuff. And they were nice to her. But, if you've got a situation like that where you're going to be on your back for a few days, how nice is it for your wife, for your children to be able to go home at night, sleep in their own bed and take a bath and come back, with fresh clothes and a fresh look for you, and that makes you feel better, doesn't it? Does. And I mean, that's another reason I think you want to stay here local. I think that unfortunately, because of things in the past, we've conditioned a lot of people in this town to go elsewhere for their care. And now they don't have to for a lot of that kind of stuff. It's a great thing that y'all bring to our community.
That's what we want to know. And we're not going to be perfect. Sometimes the thing that bothers me the most is when someone would call up and say that someone was rude to them or didn't care or something like that. I mean, that's the thing that disturbs me more than anything else, because there's no reason or excuse for that. And truthfully, at times, our emergency department is so crammed and so busy that we're running around like mad things trying to make sure that we don't miss anything.
Right.
So we can't really stop and do all the nice conversation we'd like to, but there's never an excuse for not taking someone's personal needs to heart and doing the right thing by them. That's what we really try to grow into. Technology, we got it. Education, we got it. Expertise, we got it. Now we just got to learn how to serve that properly, right? And do it every single time. So I think we're really good at it, but we're going to get better and better at it.
Well, one of the things that I think a lot of people are aware of, every time I've stayed here, I've had my visit followed up by a telephone survey from some people. They're always from Tennessee, so when I see the Tennessee line, the first thing is, who do I owe? Okay, it's not anybody I owe, so it's probably, and they survey about what you're doing every time, and they give you all those results back, because that's so important to you to help provide and develop that quality of care.
Well, we do care about that. We care a lot about the survey. We care a lot about the feedback. I mean, I wish there was a way that we could come up with where every single person that comes in the ER could say to us, this is where you were great, this is where you were pretty good, this is where you weren't so good. Because that weren't so good need to be taken care of, and that's what we really care about, is making sure that those people understand. And here's another thing you have to understand. We went from 15,000 visits a year 2 years ago to last year over 21,000. So in 1 year, we went up over 30%.
30% plus.
35%, right? And this year, we're already on track to go up another 10 or 15%. And if you look at national averages, if you're seeing 1,500 people per year per room in your ER, you're maxed out. Well, we have 10 rooms. 10 times 1,500 is 15,000.
Yeah.
So at 15,000, we were already full.
Yeah.
At 22,000, we're kind of overloaded.
Well,
The good news is there are plans in the offing, shall I say it?
there are a lot of plans in the office
There are.
for this place that people don't even realize that are so great. And I hope that you and I'll be able to talk about that, or with some people from the board, which you sit on here in Andalusia Health, to talk about those plans at another time. It looks like we've run out of time today, though.
Well, it's not hard to do. This has been fun.
Well, it's been a great conversation.
Thank you.
And we thank you so much for being in Andalusia and being in Andalusia Health.
Well, I thank you for the opportunity, and I thank everyone out there for their trust in what we're doing.
Well, thanks a lot.
All right.
Y'all take care. We'll see you later.